morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Well, welcome back to Insurance Matchmaking. I have a repeat guest on today, Ward Norris with County Veteran Service Office. Last time he was on, he was still in training. Now you're all trained up now. I mean, I'm sure you have other training to do, but...
Always, Matt. Hey, first of all, thanks for having me on your show. I really appreciate you giving me an opportunity to talk to the community through your show.
So when Ward was on, even though he was still in training, when we got done, he's like, I still got more stuff I want to talk about. So we finally worked up a time we could get back together. We're totally different from my regular schedule. We're on a different day. We're earlier in the morning because he has to be at the office earlier than I do. And so it's kind of funny coming in the studio this morning. It's like there's nobody here, but our
parking was great.
Yeah. So we didn't practice before we started here. I know there was things we wanted to talk about. Obviously, there's different projects that you've taken on or started since we were last on here. What's coming up next, or what's on top of mind for you?
So Matt, there's a couple things, and one of them has to actually do with insurance, and the other thing I just want to just put out just a message to not necessarily veterans, but family members of veterans. First thing will be insurance. I got a lot of veterans who come in and ask questions about insurance. I got a lot of questions, and some of it is about supplemental insurance, and some of it's about CHAMP VA, which is a VA insurance, and some of it's about TRICARE for Life, Medicare Part A and B, and a lot of questions about as veterans transition in life to the new types of insurances, they come in and ask a lot of questions that I can't answer.
Right.
And I think one of the questions that I would like to know is, while they're still getting Medicare or TRICARE, they ask about a lot of supplemental questions.
Right.
And just, what do I tell them? What do I tell them about?
Tell them to call me.
So I
literally. I mean, that actually really is. I've the last two people. No, I had somebody call in and had an issue, but I say I wasn't able to help him. I was able to help him, point him in a direction. He had got one. He was not a veteran, but had made that phone call to that 800 number or answered the phone and gave him enough information and found out he had his Medicare insurance all messed up. And I just told him he probably just needed to call Medicare. I mean, he wanted to file. He still can, but he was like, he wanted to charge the insurance company with doing things wrong. And it was like, technically, from what I can tell, it's not the insurance company. It was whoever this, telesales agent that signed him up. And what it was is he had a Medicare supplement, as we call Medigap, in his drug coverage. And from what I could tell, just talking to him on the phone, one of the plans that I'll talk about here in a minute was he had put him on a Medicare Advantage plan that doesn't have drug coverage, and he has a very expensive drug, and so he's got some issues there. And I basically call Medicare, because Medicare is the only one that can, if they will, is void the enrollment that he had and just put things back the way they were. He still was paying the premium for his supplement, but he couldn't use it because once you go on a Medicare Advantage, that's your primary. So that was, but it was kind of ironic because it was like I'd just gotten off the phone talking to a TRICARE for Life person, and then he had actually called while I was talking to that person, so I called him back and figured that was the kind of plan he had. The questions I have, and I know I'll give you a chance to jump in here, because, well, I mean, you have TRICARE, but you're not TRICARE for Life. You're not old like me. But what I've been working with a lot of folks lately is, I always tell them in the beginning, you have TRICARE for Life, so you have your Medicare, and you have TRICARE for Life. You don't have to do anything else.
Well, my understanding is when you turn 65, even though people my age can't draw Social Security, you have to start paying for that Part B.
Yeah, and that's one of those things that, and again, I'm one of those. I was born in 58, and so I am now 60. Basically, I'm 66 and 8 months in August. So, and actually, this show will still air this month in July here. I'm actually started drawing my Social Security, but I've been on Medicare for a year and a half. And the big shocker and what gets people is, as you know, even for a family plan, we don't pay much for TRICARE. It still kind of sticks in the craw that we're paying for it, And he goes, I don't know. You're younger than me. Your recruiter may not have done it, but boy, I can tell you when I went in, hey, give us 20 years and you never have to worry about your health care for the rest of your life. Which I could still kind of say that, but it was always implied you'll never pay for health care.
And I think you bring up a very, very important – you're not the only one that has said that. I've had people come in and said, well, my recruiter said if I go and serve, then my health care will be covered. And what VA health care is health care. It's not an insurance. And I think a lot of people get confused. They say, well, I'm going to go to the doctor, just bill the VA. Well, the VA is not insurance. It's a health care program. And so I get a lot of veterans in who say, well, the VA is not paying for my health care. Well, did the VA tell you to go to the doctor? Well, no, I went on my own doctor. The other issue I get a lot of times is people who have insurance, Blue Cross, Blue Shield, will go to the hospital, and the hospital will always charge the insurances first, and then try to send the rest of the bill to the VA, and the VA says, we don't pay that. A lot of times I have to send the veteran back, say, hey, you're over 50%. Go back, ask the hospital to refund Blue Cross Blue Shield, and charge the VA. The VA would pay 100% of that. Yeah, and so
that's one of the things I always tell any veteran, especially if they use the VA that are on Medicare. Do not, if you're conscious, if you're aware of what's going on, and tell your family members in case maybe they call the ambulance or do not give them your Medicare card. Give them your VA card. And then if VA says they're not going to pay it, then you pull out the Medicare card and Medicare will pay something. But as I mentioned with the TRICARE folks, I always tell them because, I don't want to mislead them, but you literally, when it comes to Medicare, if you have TRICARE for life or you have TRICARE, so when you turn 65, that becomes called TRICARE for life. It works like a Medicare supplement. It picks up the part that Medicare doesn't. But you do have to get Medicare A and B, because if you don't get Medicare A and B, you don't have TRICARE either.
And if you decide you don't want it at the time of 65, you're not saving any money. Because they're going to come back and get it back later.
Yeah, and that's what I tell the veterans who are use the VA that aren't TRICARE. They didn't retire. A lot of people, obviously, Ward knows what I'm talking about. But there's a lot of people think TRICARE and VA are the same thing. They are veteran benefits, but they're not the same thing. And TRICARE is not administered by the Veterans Administration. That's why it's VA health care. That's administered by the Veterans Administration. TRICARE is actually, in our area, and maybe in some other areas in the country, is actually managed by Humana.
Yes, TRICARE East is.
Yeah. So, like I said, I'm not sure what it is out west, but it's managed by a private insurer. They manage it. And employers do that too. Employers, a lot of times, and probably the most common, I usually don't use insurance companies, but most common is going to be usually United Healthcare. And those they're managing the billing and and all that, but the companies are self-insured. Company my wife worked for in Knoxville, big company. Got a lot of gas stations and travel centers around, if you kind of get my drift there. But they were self-insured. So everybody would talk about their insurance being, and it was administered by the insurance company, but it wasn't. That's not the insurance they actually had. The insurance was actually their employer. So, but with TRICARE, as I said, I tell people, you don't have to do anything else because, one, we have Express Scripts. That's our prescription coverage. That doesn't change when you go on TRICARE for life. It just carries forward. And then so you have Medicare. You pay that Part B premium, which currently is $185. I'm sure it'll go up in January. They'll probably, if there's any kind of raise to Social Security, it will go up. And then TRICARE, which becomes TRICARE for life, works. And I always say it works kind of like what would be a Medigap Plan F, because you don't have the Part B deductible, which is $257, and then it picks it up. And I myself, I actually have one. I have a Medicare Advantage plan. If I didn't have TRICARE, I probably would not have a Medicare Advantage. I'd probably have a Medigap. But you don't need it. Having that Medicare Advantage plan, paying part of that Part B premium, maybe giving you free dental and vision benefits and over-the-counter benefits, those little things come in handy. Oh, and I forgot. In gym memberships. So there's a couple different plans out there. Most common one most people know about is called Silver Sneakers.
Yep, I've heard of that.
One of the drawbacks of Silver Sneakers is it doesn't work at the YMCA. It used to. A couple years ago, they ended up not being contract with each other. You can have silver sneakers. It's not going to do you any good at the YMCA these days. And then there are other plans. There's also Silver and Fit, Renew Active. That one's actually specific to United Healthcare. It's their own company. And that one just changed a little bit this last year, that the YMCA is not a primary fitness facility. It's one of the premier. So there's a couple plans out there that will do that. Some fitness centers are what they call premier, but it's like then you paid like $10 a month instead of paying $50 a month would be like the regular membership or something like. So it's still a good deal. And I know I kind of droned on about it. You brought up about the paying the Part B. Mm-hmm. Those of us that didn't take Social Security before age 65 or at age 65, Medicare starts at 65. Mm-hmm. Doesn't start at 62. You can start your Social Security then. But to hit that full retirement age, anybody, and I don't remember when it started, but somewhere in the mid 50s to 1960, you couldn't get it. You weren't full retirement age at 65. Anybody right now, currently anyone now, you're full retirement age at age 67. Mm-hmm. So like age 59, it was because that hit my wife was 66 and 10 months. So she hasn't hit her full retirement yet, but I'm hitting mine. And the beauty of that is if you're working like myself, you have to worry about your income. Mm-hmm. And so now at 66 and 8 months, I can draw my Social Security, and it doesn't matter how much I earn, they won't take any of it back, because if you hit a certain threshold, for every $2 you made over the threshold, they took $1 of your Social Security back. Right. So it made sense for me to go ahead and wait to that full retirement age.
Don't they recalculate it anyway, though?
What do you mean recalculate?
Like what if you take it early? Then
no, when you take it early, that's your rate.
Okay, even though you're paying into it and they're taking back. They don't recalculate it when
right.
you retire?
Not as far as I know. I'm not a Social Security expert, but that's the way I understand that part. So it didn't make sense for me to take it early. But hold that thought. We're actually up on the break. And if I don't remember, when we come back, remind me about the Part B premium and not on Social Security. We'll be right back.
Staying connected is what matters most at home and in business. Whether you're connecting with loved ones or collaborating with teams across the globe, you need advanced communication solutions that you can count on. Twin Lakes delivers just that. Powerful fiber-powered services that keeps homes and businesses connected every day. From high-speed internet with speeds up to 8 gig to HD TV, smart security, phone service, and custom business solutions. Call 800-644-8582 or visit twinlakes.net to learn more.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, we're back on Insurance Matchmaking and meeting today with Ward Norris with the Putnam County Veteran Service Office. And I mentioned just before the break about the Part B premium and the ramifications of when you aren't drawing Social Security. So what happens there is, because you're not drawing Social Security, because it would normally just come automatically out of your Social Security check to pay that $185, Social Security says, oh, we got to make sure we got your payments, so you got to pay us 3 months up front, $555, $185 times 3. Now, once you've paid that, you can set up a auto draft or easy pay, as they call it, and it comes automatically then out of your checking account or bank account. Otherwise, so you don't have to pay 3 months at a time every 3 months. So, but it hits you hard. I think I see it more. Well, even with TRICARE, you were used to paying like $14 a month for a family plan, and then Uncle Sam says, "Oh, you owe us $500 for your insurance," and you weren't ready for that.
I think based off the number of questions, I think this is a really gray area, or just people aren't educated on what's coming and about to hit them. And every once in a while, I'll get somebody in the office who says, well, I want to lean forward and make sure I plan accordingly for the transition. And I never quite understood what they were trying to do because, like I said, once you hit 65, you don't have to pay that $185. You can wait, but then they're gonna make you back pay it.
Yeah.
So they'll send you the bill. So you're paying it whether you want to pay it or not.
Right. Well, especially with TRICARE, you have to have it. It's not an option if you want to keep your
TRICARE
Yeah, well,
for
it's
life.
an option if you want to keep your TRICARE.
Mm-hmm.
If you don't care about your TRICARE, then you don't have to do it. But but if you're on the VA, you're using the VA, and you're like, well, I'm not paying for my health care, or I go to the VA and I pay a $10 copay, or whatever your situation is. I don't need Part B, and you'll have some of the nurses at the VA say, oh, you don't need to get Part B. Then you go to the VA website. The VA website says, we recommend you get Part B when you turn 65.
And this isn't just necessarily for you, but you got your spouse that you got to think about as well.
Yeah, well, especially with TRICARE, because you got to keep your TRICARE in place. And that's the thing. One of the couples I spoke to, she's still in her 50s, so she needs her TRICARE for a while, not just TRICARE for life. But generally, yes, it's if you have a spouse, you're worrying about it. The other thing is, if you don't get Part B when you're first eligible, there is a late enrollment penalty, and it's 10% per year. So currently, your Part B premium is $185. So if you're a year late, well, you're going to add $18.50 to that $185. But that's not just one-time penalty. That's forever, and it goes, and that 10% gets added each year. So it's 10% of the current. So depending on how many years you go, you could be paying double for your Part B premium.
And my understanding is you can't just enroll any time. Once you miss your 65 window, you have to wait for open enrollment to get back into it.
Yes. It's actually called the general election period, or general enrollment period, which is the first quarter of the year, January 1st to March 31st. And up to just, I guess maybe it's 2 years now. You could enroll then, and your Medicare started on July 1st.
Yeah. That same year. So you're uncovered for 6 months.
Right, yeah. So it's like you found out, I need to get this, and it's July. Well, you'll have insurance in a year. And don't forget that 3 months, you better do it during then. Now it takes effect the next month. So if you went in on January 15th to Social Security or went online and signed back up or signed up for Part B, it would start on February 1st. It always is on the first of the month. So I always recommend, and that's why, and I encourage people to look at those Medicare Advantage plans. Don't call an 800 number, because they're just going to put you on whatever plan that's going to work for them, and may not be the plan that works for you, because one of the things with the Medicare Advantage is there are networks. So you have to make sure, because that Medicare Advantage is now your primary plan. Medicare isn't. It replaces Medicare as the payer. So you have to be aware of what you... And I think it's funny because a lot of agents are afraid to talk about these Medicare Advantage plans with TRICARE people because they don't understand TRICARE. They don't. Because with VA, it doesn't coordinate with VA. So it's separate. So, and then Medicare is separate. You use Medicare or you use VA. They don't mix. And if you want to go see a doctor that's not part of the community program with VA because you want to see that doctor, you can go to that doctor, and now you got a plan that's going to help you pay for that. You can do that on VA now, but you're going to pay out of pocket. So most people don't do it because their VA's not paying for it. The downside is, and like I said, and it doesn't matter, and VA doesn't care if you have the plan. It has nothing to do with your VA. You go to the VA, they're not going to turn you away because you have a Medicare Advantage plan.
Nope. If VA is again, it's just health care. It's not an insurance. And I think a lot of people get confused that I'm just going to use my VA insurance. I get a lot of questions about VA insurance. I'm like, well, VA only has two insurances. There's a life insurance and there's Champ VA. Are you talking about one of those? No. Where I go to the clinic, I'm like, that's health care. You can't go to a doctor and then have them bill the VA because unless it's urgent care or emergency room, the VA doesn't work. They're not an insurance company.
Right. So and I think it works. It's a little easier with the TRICARE folks because they're already used to working with networks. You have to make sure that your doctor will take TRICARE. Yes. So they're used to dealing with the networks where those that use the VA, and again, sometimes, hey, they just want it because it's going to help them pay their Part B. Maybe get the dental and vision and the over-the-counter. and they're never going to use it. I've got one client that I had on one of those plans. He's 100% disabled. He has 100% disability. Got it for the extra benefits. He's seeing a civilian doctor as part of the community plan. So he sees the doctor. He's still using his VA, whether that doctor was in network or not, with community care.
Yeah, the VA sent him to the doctor.
Right.
And then therefore the VA will pay for it.
The problem was, and I don't remember now what it was, but the VA doesn't cover the drug the doctor's prescribing.
If he's 100%, though, the VA should cover that drug.
He said he couldn't get it from the VA because it wasn't on their formulary. So he ended up getting a plan that came with the drug coverage. So it was like we were looking at it. It was like, well, yeah, there's some high copays for like hospital or whatever. Wait a minute, that doesn't matter. You're going to get a little bit of, the Part B give back. It doesn't come with any dental benefits. Well, you didn't need that anyway.
Yeah, because
but it was
100%. The VA can cover his dental.
Yeah. So he was, he just wanted something that was going to cover this, and it was
Drug.
one of those drugs, that I always like to say is like, if you see on TV, we used to have the donut hole, expected to have the donut hole. Now we have the $2,000 maximum out of pocket on Part D. If you see it advertised on TV, expect to hit that $2,000.
Good grief.
Maybe we need to set up a time that I can do a class just on, what some of those things there, and answer some of their questions. It could be an educational thing. Hopefully they might come to me and go, "Oh, that sounds good. Can you help me get that?" Yes, I sure can.
or maybe I just get some of your business cards and say, "Oh, you have an insurance question. Let me give you a
that
card
works for me too.
Call this guy. He's a veteran and he understands insurance." Because this is a lot for me to understand.
Right. And I'm not expecting you to go back and say, "Okay, you just had this 30-minute block of instruction. Now go and share that with your veterans." And the thing is, and each of their cases are different. You know that. That you it's like you have some commonalities, but everyone's unique. Their situation is different, and that's the same with insurance. Like I said, this guy that called me on the phone last week, it was like, I hadn't dealt with that before.
So one of the other things I want to ask about, and when a veteran is 100% P&T, permanent and total, it makes their family eligible for CHAMP VA.
Yes.
CHAMP VA is a 75-25, where the VA will pay for 75, but they're still responsible for that 25%. What should I tell those veterans?
They could do the same thing, and I treat them basically like I do the TRICARE people.
That makes a lot of sense.
Let's not do a plan that has the drug coverage because it messes up your other. And generally, well, now that they have the 2,000 max, it's a little different. When we used to have to deal with what they called the donut hole, you didn't want to give up your TRICARE or your CHAMP VA drug coverage. Now, Part D might be work better for you, but I still generally advise against doing a plan that includes the drug coverage because one thing, especially with TRICARE, it messes up. You can't get the mail order. I guess you could still, and generally, if you can't do the mail order, then Express Scripts generally will refuse to pay for things. But they put in what we call the M3P, the monthly prescription payment plan, was one of the things that came out of the Inflation Reduction Act that imposed that $2,000 max on the drugs, is you can set up a payment plan with your insurance carrier. You don't pay a penny at the pharmacy. You go to the pharmacy, they run your card, they give you your prescription, and your full charge is debited onto your payment plan. And then you pay that, and so it's basically divided up so that in December you will have paid it off. So that's a little different. And again, like I said, most of the time with veterans or veteran type accounts, whether it's VA, CHAMP VA, or TRICARE, let's look at a Medicare Advantage plan but not get a drug plan. You do not need a Part D. The other thing I'll run into is veterans who will go, well, I got this Medigap Plan G just in case I need to use it. Okay, why are you going to pay $150 a month for a plan that you might not use? That's what Medicare is. Your Medicare is your backup. Okay, you may have to pay $257, and now you're going to have to pay 20%. But that's only if it's something you're not going to the VA for. So how many times are things going to come up that's not your VA? And that's why, to me, it makes sense. You can get a zero premium Medicare Advantage and still never use it, but that's your backup. Don't get a Medicare supplement. You're spending money. Not if you have veteran benefits. So, Ward, believe it or not, we're coming close to the end here. Well, so you got about 2 minutes.
Well, and maybe it's for the next show. But one of the things I really wanted to hit on was family members of veterans. we're getting a lot of, as veterans get older and need more assistance, the children have been, and the children, I say children, I'm using the term loosely.
They're your age.
or older, are trying to help their parents. Yeah. And one of the frustrations they have is their parents never came in, or their veteran family members never came in and requested any type of VA benefits, VA assistance of anything. And whether it's they believe that, I never served in combat, I never served in war, they have these misunderstandings of, they say, I don't deserve it. I don't know where that comes from, but I'm going to say that, in the next show, I just want to talk a little bit about the frustration. And it really breaks my heart that they're trying to help, but they can't.
For this, quick, how do people get a hold of you?
We are located on 1656 West Broad Street. A lot of people walk in, and our phone number is 931-526-2432.
All right, and remember, at Matt Libby Insurance, we can cover you from head to toe. It doesn't have to cost you an arm and a leg, and we'll talk to you next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.